Hello, and welcome to our channel. Today, we are diving into a topic that is critically important for seniors and their loved ones, a topic that does not get nearly enough attention. Have you ever taken a common pill without realizing it could increase your risk of dementia? It's a sobering reality that many medications prescribed to older adults or even available over the counter may quietly contribute to cognitive decline. These aren't obscure or rare drugs. They're everyday medications that millions of people use, often unaware of the potential dangers to their brain health. If you're over 60 or if you care for someone who is, this video is for you. We are going to uncover 4 types of commonly used pills that neurologists warn may raise the risk of dementia in seniors. This isn't about scaring you. It is about arming you with knowledge backed by research and clinical insights. You'll learn how these medications affect the brain, why they're prescribed so frequently despite the risks, and most importantly, what you can do to protect your memory and independence. Stick with us until the end, because we'll also share practical steps you can take to have meaningful conversations with your doctor and safeguard your cognitive health. This is about empowerment, not fear, helping you live smarter, longer, and with greater peace of mind. Let's get started. Section 1. Anticholinergic medications. First on our list are anticholinergic medications, a category of drugs that are incredibly common but carry significant risks for seniors. These medications are prescribed for a wide range of conditions, including allergies, overactive bladder, sleep disorders, and even gastrointestinal issues like irritable bowel syndrome. At first glance, they seem like a godsend. They can stop a runny nose, calm an overactive bladder, or help you sleep through the night. But there's a hidden cost to these drugs, especially for older adults. Anticholinergic drugs work by blocking a critical brain chemical called acetylcholine. This neurotransmitter is essential for memory, learning, and overall cognitive function. When acetylcholine is suppressed, even temporarily, it can lead to side effects like confusion, forgetfulness, and difficulty concentrating. For younger people, these effects might be mild and reversible. But for seniors, whose brains are more vulnerable due to age-related changes, long-term use of anticholinergics has been strongly linked to accelerated cognitive decline and an increased risk of dementia. Research, including studies published in journals like JAMA Internal Medicine, has shown that prolonged use of strong anticholinergic drugs can increase dementia risk by as much as 50% in some cases. This is particularly concerning because many seniors take multiple medications with anticholinergic properties, often without realizing it. The effects can stack up, creating a cumulative burden on the brain. Let me share the story of Ellen, a 74-year-old grandmother from Ohio. Ellen had been dealing with chronic allergies and frequent nighttime bathroom trips for years. Her doctor prescribed an antihistamine for her allergies and a medication for her overactive bladder, both of which had anticholinergic effects. At first, Ellen was thrilled to find relief, but over time, she started noticing troubling changes. She was forgetting names, misplacing items, and feeling foggy during the day. She chalked it up to just getting older, but her family grew concerned. After a visit to a pharmacist, Ellen learned that her medications could be contributing to her cognitive issues. With her doctor's guidance, they adjusted her treatment plan, switching to alternatives with fewer anticholinergic effects. Within months, Ellen felt sharper, more alert, and more like herself. Her story is a powerful reminder that what seems like normal aging might actually be a side effect of medication. What makes anticholinergics particularly tricky is how widespread they are. They're not just in prescription drugs like those for bladder control or Parkinson's disease. They're also found in over-the-counter remedies for colds, allergies, and sleep. Medications like diphenhydramine, commonly found in Benadryl or PM pain relievers, or older antihistamines, have anticholinergic properties. Many people assume that if a drug is available without a prescription, it's safe for regular use. But for seniors, especially those over 60 or 70, the cumulative impact of these drugs can quietly erode brain health over time. If you are taking an anticholinergic medication, or suspect you might be, the first step is to review your medications with a healthcare professional. This could be your doctor or a pharmacist who specializes in geriatric care. Ask questions like, does this medication have anticholinergic effects? Are there safer alternatives for my condition? Can we reduce the dose or try non-drug options? Sometimes, non-pharmacological approaches, like lifestyle changes, physical therapy, or allergy management techniques, can reduce the need for these drugs. The goal isn't to stop treatment you need, it's to find a balance that supports your health without compromising your mind. Staying informed is your best defense against the hidden risks of anticholinergics. Section 2. Sleep aids and sedatives. Next, let's talk about sleep aids and sedatives, including a class of drugs called benzodiazepines. These medications are often prescribed for insomnia, anxiety, or restlessness, conditions that become more common as we age. While they can provide much-needed relief, helping you fall asleep or feel calmer, their long-term use can come with serious risks to your brain health. Sleep aids and sedatives work by depressing the central nervous system, slowing down brain activity to induce relaxation or sleep. This can be incredibly helpful in the short term, especially if you are struggling to get restful sleep. But over time, this suppression of brain activity can disrupt the natural cycles of rest and alertness that your brain relies on to maintain memory, cognition, and emotional regulation. Studies, such as those published in the BMJ, have linked long-term use of benzodiazepines and other sedatives to a significantly higher risk of dementia in seniors. The risk is especially pronounced with prolonged use. Think months or years rather than occasional use. These drugs can also cause confusion, memory lapses, and even disorientation, which can be mistaken for early dementia or normal aging. Consider Henry, a 78-year-old retired accountant from New York. Henry had struggled with sleep for years, tossing and turning through the night. His doctor prescribed a benzodiazepine to help him rest, and at first, it was a game changer. Henry was finally sleeping through the night. But after several months, he started noticing changes. He was forgetting appointments, struggling to focus on simple tasks, and feeling disoriented at times. His family grew worried and urged him to see his doctor. After a thorough review, Henry's doctor confirmed that the benzodiazepine could be contributing to his cognitive issues. They worked together to gradually taper off the medication while introducing non-drug strategies, like a consistent bedtime routine and relaxation techniques. Over time, Henry's mental clarity improved, and he felt more present in his daily life. Sleep aids and sedatives are incredibly common in senior care because sleep problems can significantly impact quality of life. Doctors often prescribe them to provide quick relief, and they do work, temporarily. But the long-term risks are often under-discussed. Older adults metabolize these drugs more slowly, meaning they stay in the system longer, increasing the risk of side effects like dizziness, falls, and cognitive impairment. Falls are especially dangerous for seniors, as they can lead to injuries that further compromise independence. If you're using sleep aids or sedatives regularly, it's time to have an open conversation with your healthcare provider. Ask about the risks and explore alternatives such as cognitive behavioral therapy for insomnia, CBTI. This is a highly effective non-drug approach to improving sleep. Sleep hygiene practices, simple changes like avoiding screens before bed, maintaining a consistent sleep schedule, or creating a relaxing bedroom environment can make a big difference. Relaxation techniques. Practices like deep breathing, meditation, or gentle yoga can promote restful sleep without medication. The key is to balance immediate needs with long-term brain health. Sleep is crucial, but so is protecting your cognitive function. By exploring safer paths to rest, you can preserve both your nights and your days filled with clear thinking and joyful moments. If you're finding this information helpful, please comment number 2 below to let me know you're here. And if you haven't already, hit that subscribe button and turn on the notification bell so you don't miss any of our videos. Your support helps us keep creating content to inform and inspire you. Section 3. Certain antidepressants. Now let's move on to our third category. Certain antidepressants, particularly older generation drugs like tricyclic antidepressants. Antidepressants are a lifeline for many people managing depression, anxiety, or other mental health conditions, and they play a vital role in improving emotional well-being. But not all antidepressants are created equal, especially when it comes to their impact on cognitive health in seniors. Tricyclic antidepressants, such as amitriptyline or nortriptyline, work by altering the balance of neurotransmitters like serotonin and norepinephrine, which regulate mood and cognition. While these drugs can be effective for treating depression, they also have anticholinergic properties, which, as we discussed earlier, can interfere with memory and cognitive function. Long-term use of these older antidepressants has been linked to an increased risk of dementia, according to studies like those in The Lancet. For seniors, the side effects of tricyclic antidepressants, such as confusion, memory problems, and slower thinking, can be particularly pronounced. These symptoms are often mistaken for natural aging or even early dementia, but they may be exacerbated by the medication itself. Let's look at Linda, a 69-year-old retired nurse from Colorado. After losing her husband, Linda struggled with depression and was prescribed a tricyclic antidepressant. It helped lift her mood, but over the next few years, she noticed increasing forgetfulness and difficulty concentrating. Simple tasks, like balancing her checkbook, became frustrating. Concerned, Linda consulted a new doctor who reviewed her medications and explained that her antidepressant might be contributing to her cognitive decline. With her doctor's guidance, Linda transitioned to a newer class of antidepressants, like an SSRI, selective serotonin reuptake inhibitor, which has fewer cognitive side effects. Over time, her mental clarity improved, and she felt more like herself. Linda's story highlights the importance of regularly reviewing medications with a healthcare provider. Tricyclic antidepressants are still prescribed because they are effective for certain conditions and often less expensive than newer options. However, their risks to cognitive health, especially in seniors, are significant. Newer antidepressants like SSRIs or SNRIs are generally considered safer for the aging brain, but they're not without their own considerations. The key is finding a treatment that supports both mental health and cognitive function. If you or a loved one is taking an older antidepressant, do not stop or change the medication on your own. This can be dangerous. Instead, have an open conversation with your doctor. Ask, could my antidepressant be affecting my memory or cognitive health? Are there newer medications with fewer cognitive side effects? Can we explore therapy or other non-drug options to support my mental health? Mental health is just as important as cognitive health, and the goal is to find a balance that supports both. By staying informed and advocating for yourself, you can make choices that protect your mind while addressing emotional needs. Section 4. Over-the-counter PM. Pain relievers. Finally, let's talk about over-the-counter PM pain relievers, a category that many seniors reach for without a second thought. These medications, often marketed for pain relief and sleep, contain sedating ingredients like diphenhydramine, found in products like Tylenol PM or Advil PM. While they're effective for easing aches and helping you drift off, regular use can have serious consequences for brain health. Like prescription sleep aids, PM pain relievers work by depressing the central nervous system, leading to drowsiness. This can be helpful for occasional use, but frequent use can dull brain function, reduce mental sharpness, and increase the risk of dementia. The sedating antihistamines in these drugs have anticholinergic properties, which, as we have discussed, can impair memory and cognition, especially in seniors. The danger lies in how accessible these medications are. Because they're available without a prescription, many people assume they're safe for daily use. But for older adults, whose brains are more sensitive to these compounds, regular use can lead to confusion, memory lapses, and even disorientation. Take Joe, a 75-year-old retired mechanic from Indiana. Joe used PM pain relievers to manage arthritis pain and occasional insomnia. They were easy to buy and worked well, so he took them most nights. Over time, his family noticed he was becoming forgetful, missing appointments, and even getting lost in familiar places. After a medication review, Joe's doctor identified the diphenhydramine in his PM pain relievers as a potential culprit. With guidance, Joe tapered off the medication and explored safer alternatives, like physical therapy for his arthritis and relaxation techniques for sleep. Gradually, his mental clarity improved. The ease of access to PM pain relievers makes them a hidden risk. Seniors often take them without consulting a doctor, assuming they're harmless. But the aging brain is more vulnerable, and these drugs can accumulate in the system, causing side effects that mimic aging or dementia. Reading labels carefully and consulting a pharmacist or doctor is crucial. If you're using PM pain relievers regularly, take these steps. Check the ingredients. Look for diphenhydramine or other sedating antihistamines on the label. Talk to a professional. Ask your pharmacist or doctor about safer pain management or sleep strategies. Explore non-drug options. Consider physical therapy, gentle exercise, heat therapy, or relaxation techniques to address pain and sleep issues. Protecting your brain means being cautious about both prescription and over-the-counter medications. Awareness is the first step to maintaining mental sharpness and quality of life. If you found this section valuable, please comment number 4 below to let me know you're here. And don't forget to like, subscribe, and share this video to help us spread this important information. Final thoughts. As we wrap up, let's recap the 4 types of medications we've discussed: anticholinergic medications, sleep aids and sedatives, certain antidepressants, and over-the-counter PM pain relievers. Each of these carries hidden risks to cognitive health that many seniors aren't aware of. But knowledge is power. By understanding these risks, you can take proactive steps to protect your memory and independence. The most important action you can take is to have an open, honest conversation with your healthcare provider. Bring a list of all your medications, prescription and over-the-counter, and ask about their potential cognitive side effects. Explore alternatives, whether that's a different medication, a lower dose, or non-drug approaches like therapy or lifestyle changes. Your health, your memory, and your quality of life are worth advocating for. This is not about stopping essential treatments. It is about finding a balance that supports your overall well-being. You deserve to feel good and think clearly, and with the right approach, both are possible. Thank you for watching. We'd love to hear from you. Please leave a comment below sharing one thing you learned today and how you plan to use it. Your thoughts inspire us to keep creating content that informs and empowers. If you found this video helpful, please like, subscribe, and share it with others who might benefit. Your support helps us continue this mission. Until next time, stay informed, stay proactive, and keep prioritizing your health. We will see you in the next video.